of addiction is greater, the earlier you get exposed
Well, I
to it.
started doing drugs at 11, 12. That's when my addiction started. Alcoholism.
And you were molested before that.
Yeah.
Yeah.
So it's
That's-
like, you know what I mean? I went into, so it's like, I can't even believe I'm here, to be honest with you.
Yeah, it's
The
quite an
road-
achievement.
Yeah, yeah.
I'm
the
not gonna-
road, you know what I mean?
you know.
But I took, but yeah, and then I got sober at 17, which is so. I mean, it was a miracle because it's like, you know, I found, you know, I believe I found God at 17,
Yeah.
and then you know, if I wasn't in AA, I don't think I would have done stand up because I had a lot of encouragement from the community.
Yeah.
The sober community to go follow your dreams and stuff like that. So it's
Yeah.
like,
Let's suppose that porn was very accessible when he was in the 80s, 70s, 80s, and a young Bobby at 11, 12 who had been molested.
oh yeah,
is now
yeah, I would have
consuming
been.
it
Oh yeah, it would have fucked me up.
every day.
Yeah, but I mean, he started using substances at like 11 or 12,
that's
right? So I think this is where, like, basically, so we'll talk about the effects of being molested in a minute, but let's finish on the porn thing, and then we'll come back.
Yeah.
Yeah, just hang tight, okay?
I love it.
Okay. So, so the key thing to understand about pornography is that what a lot of people don't understand is that it's actually about emotional regulation more than anything else.
Huh.
So, you know, most of the people who I work with who are addicted to pornography, people assume that there's a lot of masturbation. But for a lot of people, it's like second screen stuff. So it's like literally like, patients who are like in investment banking or private equity, and they're like financial modeling on Excel on like screen number one. And there's like, you know, somebody getting railed on screen number two.
Yeah.
And so the interesting thing, if you kind of think about it, right? So our body is designed to procreate. And if we get an opportunity to procreate, we can basically shut off everything else in order to make that happen. So if you think about, you know, the emotional effect of sex, if we're feeling anxious, like there are absolutely cases of hyposexual desire disorder and things like that, or like, you know, if you're really depressed, it's like hard to get aroused. But if we think about if you are able to get aroused, what does it do to your other emotions? It basically wipes them clean.
Yeah.
And earlier we were talking a little bit about, you know, the feeling of taking a piss. So in Sanskrit, then if we talk about meditation, there's a state of temporary enlightenment called Samadhi. And so when we meditate, we're trying to get great.
Yeah. Yeah.
So when we're trying to get to Samadhi, like that's why people meditate. And once you get to Samadhi, you feel amazing.
What's nirvana then?
Nirvana is permanent Samadhi.
Oh,
Yeah.
permanent samadhi.
Yeah.
Yeah.
When the sadness disappears forever
That's death? Or can
no.
you achieve that in
life.
in life?
Yeah, so-
you can achieve nirvana in life.
Yeah, that's the only time you can achieve it.
Oh my God, that's true.
It is death of the self conscious or
That so death of the self happens, can come and go. So another random aside, since we're talking about this for a second. So if you look at the you know, I don't know if you guys have seen these like studies on psychedelics being useful for
Yeah.
mental health.
Yeah.
So the really cool thing is you can actually ask someone what their psychedelic experience was, and based on their subjective experience, you can predict whether they have an improvement in trauma or treatment refractory depression.
Yeah, I had a ketamine, I did ketamine therapy once and once only. And when I say like it was so effective
Yeah.
compared to any like SSRI I had been taking like years prior as like a
Yeah.
younger person, I was shocked by how well it worked.
Yeah.
Yeah.
So the interesting thing is when people have an ego death experience in psychedelics, so if I just see like colors, or even if I have something like synesthesia, that doesn't correlate with a mental health improvement. It's specifically the ego death experience. And that's why people are into the heroic dose, because the heroic dose is what is most likely to have an ego death experience.
And that's like a heroic dose of like macro dosing, like mushrooms or
Yeah, so the scary thing that people don't talk about, which we oftentimes don't see in the studies, and they're like, we can get into the technicalities of that. So I have had an equal number or greater number of patients who will get PTSD from trips,
yeah.
who will develop panic disorders, because it does have a lot of neuroplasticity. It like puts your brain into like from read-only mode into like edit mode. But depending on what kind of trip you have, it can be incredibly traumatic, it changes the way that your physiology can be wired. So it's kind of like playing with fire.
Yeah, that's exactly how I felt